So there's a whole spectrum of things currently now. Even when I was a student, we were looking at something called cognitive remediation, where we would do enhanced educational things to enhance behaviors, or maybe give them tutoring during school or something like that. But now that we know that the long-term survivors are at risk, I think we need to shift a little bit now and say, what can we do for our adult survivors, pediatric cancers? And there are two big things that you can do right now. One is exercise. We know from literature in the non-cancer population that as long as you stay physically active, that helps preserve brain matter, and it helps preserve, keep you from having these normal cognitive declines. And I'm not talking like going to the gym, lifting weights for 30 minutes and getting on a treadmill. You can do things as simple as just finding a hobby that you enjoy, and then do that 30 minutes a day, 3 times a week. If you can do that, that will help preserve your brain and maybe offset some of these effects that we're seeing. The other thing too is staying mentally active as well. So I'm not talking about going back to college, but things that you can do is like, if you're interested in beekeeping, then read about beekeeping. Learn about something new. As long as you're constantly learning, the brain will constantly change in response to that as well. So I call it mental gymnastics as well as physical gymnastics. If you can do both of those will help in the long term until we can actually develop better, more effective, maybe one day we'll have a pill that you can take that'll help. So.